Hi everyone, this is Mr. Neil Wright here, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with otitis externa. So otitis externa is an umbrella term given to an outer ear infection or inflammation. And this patient attended, I believe, back in May, and they at the time also attended with otitis externa, but on that occasion the ear was severely swollen. It was really difficult to get access. I managed to get into the ear despite the ear being extremely swollen, and we referred the patient to their GP to receive the necessary treatment. And the patient contacted us earlier on the week, and they said that they visited the doctor after they received my referral. They were prescribed some medication, and they felt although the ear significantly improved, it hadn't quite fully improved. And so they booked back in with myself, and you can see the swelling's gone. And when I mean it was completely inflamed, it was just impossible, virtually near on impossible to gain access. But I did manage to gain access using a fine end last time, and I removed the majority of the discharge. I had a lot of discharge, a lot of pus. On this occasion, the patient has got what appears to be a fungal infection, and the way you can diagnose a fungal infection is there's two strains of fungal infection. The first one, which is the most common one, I think it's about 70 or 80% of the most common strain of fungal infection, at least in the ear, is Aspergillus niger. And a hallmark of Aspergillus niger is either fungal spores. They can be black or white. And you may have seen, you will see it again in a minute, this patient's got fungal spores on the ear canal, on the dead skin. You can see it surrounding that. Or another type of fungal infection is called candida. So that's more common with thrush, with children on their mouth, a soft palate and the tongue. And that's more of a creamy, thick discharge. So the patient hasn't got candida, but it's very likely they've got, as I said, Aspergillus niger, so it's fungal infection. And you can see that they're actually on the skin itself. So we're just trying to peel this away. Now, if you've got a fungal infection, it can occur if you have a bacterial infection, secondary to a bacterial infection, if the bacterial infection is not successfully treated. So if you visit an ENT, for example, and you've got a bacterial infection, they typically prescribe antibiotic spray, topical spray or drops that go into the ear and directly target the bacteria. If you are prescribed oral antibiotics, the problem with those is that they're not as effective as killing the bacteria in the ear, and it will obviously have some effect. And then because the ear is still slightly infected and the bacteria, there's less also good bacteria, because when you have antibiotics, it can kill the good bacteria as well. It gives an opportunity to the for the fungus in the ear to, if there is any there, to multiply, because it can outcompete the bacteria in the ear, especially the good bacteria. That's also, obviously, when you have antibiotics, it will also kill the good bacteria, not just the bad ones. And so if a bacterial infection is not successfully treated, there's always opportunity for the fungal infection to take rise, because antibiotics is not going to affect the fungus, you see. But if you've got a bacterial infection, because it's active, that's going to outcompete the fungal infection. So we just made sure in this occasion that when we've written to the GP again, and just advised that they take an ear swab just to confirm whether this is a bacterial infection or a fungal infection. If it is bacterial, to ensure that they have topical treatment. So I don't think they had that last time. And last time it was quite understandable, because the ear canal was so swollen. It would have been very difficult for the patient to instill any drops of spray in the ear. So if it was the case last time that the patient was prescribed with oral antibiotics, I can understand that, because it would have been really, really hard for them to apply topical antibiotics, which is always recommended if possible. Now, the other issue with topical antibiotics is if you've got a perforation of the eardrum, which the patient didn't have last time, but if a patient does have a perforation, many of the topical antibiotic sprays or drops that go directly in the ear are what we call ototoxic. And ototoxic medication, ototoxicity means medication that can cause hearing loss. So many many prescribed antibiotics for the ear, topical ones, they contain what we call an aminoglycoside. And aminoglycosides, they don't kill bacteria, but they prevent them from multiplying and regrowing. And we're hoping, because the bacteria can't multiply, after its lifespan, it dies because it can't reproduce itself, it can't multiply, and that's the way of killing it. But these aminoglycosides, and they typically end in mycin. So if you've got a medication that ends in mycin, either spelt MYCIN or MICIN, like gentamicin, neomycin, streptomycin, erythromycin, these are all forms of aminoglycosides that can cause, that are all ototoxic. So they can't be prescribed if a patient's got a perforation and they've got bacterial infection. So sometimes all antibiotics are given because you can prescribe that. However, there's a medication, ciprofloxacin. I'm not great with pronouncing medications, so I do apologise if I'm not pronouncing them as correctly as they should be. But ciprofloxacin is an antibiotic that can be prescribed, even if a patient's got a perforation, and they're normally prescribed for eye infections, and ENT and GPs used to prescribe it off-label for ear infections, but now they don't have to prescribe it off-label because they are also manufactured as separate ear drops, ciprofloxacin, and they can be used if a patient's got a perforated eardrum. So I'm just using the fine end. I'm just trying to remove as much debris, dead skin, discharge off the canal wall. We're not going to get every little aspect. We're on the bony part of the ear canal. This is a very sensitive region of the ear. So I'm just going to get as much out as we can. The hearing is significantly improved. So now that I've cleaned the majority of this infection, the patient will need to undergo a course of either antibiotics or antifungal medication. Antifungal medication in the UK, typically it's canesten. And the thing with fungal infections, they are difficult to completely stamp out. So after, again, we've written on the referral to the GP, we've ensured that if it is a fungal infection, for them to just return after the course, just to make sure it's on top of the fungal infection has fully resolved. And if not, obviously they'll need some additional course of antifungals. Key with fungal infections is to avoid humid, wet environments, avoid water, steam rooms, for example, anywhere where in the home, for example, if the fungus normally grows in these warm, damp, also can be cold conditions sometimes as well. But the key is to keep the ear dry. And we've informed the patients that they are keen swimmers, so it's advise them just to stay away. Try not to go swimming, even though you can get swim plugs, but because the ear canal's swollen as well and it's slightly infected, you don't really want to put anything in the ear. You want to keep it aerated. And just to avoid swimming in the meantime until this infection is resolved. So I've got the majority of the skin out. You can see the eardrum. Any more, it was getting slightly uncomfortable for the patient because we're on the bony part. I hope you enjoyed that video, guys. Take care of yourselves. Speak soon. And should upload some more just soon.